Hi, Nursing 204. We are going to talk about slings, braces, binders, and wraps. That I've now realized you probably can't read that because it's in pink, because it's Friday. So the Deb and Karen team today, yes, she has glasses on to protect her from my breath. But I didn't have glasses, so she had to wear the mask. So let's start with, we're going to start with this because I think everybody knows what this is. This is a boot, and for foot injury, post-surgical boot, that's usually what it's used for, is post-surgical boot, or yeah, we're just going to stick with that for right now. Pretty simple. It has Velcro, kind of like you guys did, like what, 3 years ago when you were little. So Velcro. One of the things that you need to watch out for is usually with a post-surgical boot, there's going to be dressings underneath. And so if the dressings get wet and the material gets wet, you're going to need that material to be dried out before you put a foot back in there. And so usually, because of the kind of material it is, you can get a towel in there and paper towels and absorb that, but it will need to be washed. These are washable. These can go into the wash, and preferably not into the dryer, and then set out under a heater or whatever to dry. But if they need to be used right away, then you can hand wash them, dry them, towel dry them, and then use a blow dryer if they have to have them right away. But so this is a surgical boot. Dressing changes, and also making sure that the Velcro is not too tight. You're going to check cap refill on toes when you put these on someone. You don't have a green dot. Oh, yours is blue. Okay. You're going to need to check that cap refill on those toes to make sure that it's not too tight. Because without perfusion, nobody heals. Okay? So that's the boot, the post-surgical shoe. This is a sling, and I know a lot of people have seen a sling. This is an older version of a sling because you can see there's not a lot of padding. This is a different version of a sling. It's all padding. There are several kinds. I'm sure there's some great fancy 2020 models also. This one of the most interesting things about a sling, we're gonna use this one for practice right now. And Deb has said she will assist me with practice. So application. When we talk about a sling, there's this edge right here that has to go to the elbow. And so when we apply this to a patient, the first thing we're going to do is make sure that that fits their arm. You can see that it fits their arm and their hand. You can just see the fingers so that they have kind of something even to grab onto. But that needs to be fitting like that. If it fits like this, it's too short. So you can't put a child's sling on top for an adult. A lot of times we'll show you something else that happens. But on this particular sling, there is nothing to put their thumb into. But on the other slings, there is, which I will show you. This is the Velcro strap that goes across. So we want this to be here, and we want this to go around the back of the shoulder, like this. We don't want it coming around the neck here. We want it coming around the back of the shoulder. And then we'll come to back to here. And really, it should have gone the other way, but we don't want this near you. And so also, you can see how it's going to come to the neck anyway. So we don't want it too tight. We don't want to put too much weight on that. And we want to make sure that that's coming over the shoulder and not around the neck. Okay? Yeah. So you can see that it's coming over the shoulder and not around the neck, because then it will cause secondary issues. Also, you get rubbing around here on the neck and you might end up with an injury there. All right. So when you see your patients, a lot of times you'll have to have them have their arm up here, because if they don't have their arm up there, and you don't have that tightened well enough, for them to have their arm up there. And what you'll see later, because if it's not pointed up sometimes, then what you may see later is when they walk in to talk to you at the nurse's station or wherever, they're coming in like this. Yes, they're coming in like this with their arm halfway out of the sling. We're gonna change angles. Don't get sick. Don't get sick. So they're coming in and their arm will be halfway out when they come to see you. So you do have to check on people with slings because this happens all the time. Right? So we'll make sure that that sling is. Look, I can make her dance. She goes around in circles. A little do-si-do.
Little pirouettes.
There we go. So the sling needs to be here, and usually you want it angled so that it's pointing up, so that you're taking that blood flow and making it even, but taking off. Usually the hand or the arm is swollen, and you want that above the heart. Okay, so that is a sling. We're going to pause for a moment. So in this particular sling, inside of this particular sling, there is a little piece that where they can put their thumb, so they can hang their thumb inside the sling like this, so that their hand doesn't come out of the sling. So on this particular sling, when you have your arm in this sling, then you've got this thumb hold on the inside, like that, so that they're not moving out of the sling. Okay, well, that's a sling. Oh yeah, also helps with pressure on the nerves. It sure does. So everybody's seen the triangle bandages that we all have in our fully equipped e-kits. Yes? Yes, we've all seen those. Okay, let's go back to here. Those are both short. We're bringing it down. Okay. So the big thing about, you've got the triangular bandage that can be used for many things, but the point is where the elbow is going to go. And so normally before we put it on, we'll just knot the point knowing that's where the elbow is going to go. And if you have somebody with an injury where their arm is broken and they're holding it up and they can't move their arm, what you can do is you can take this sling, tie that knot, and just tuck this, tuck this here, just under their elbow, and slide it, and they don't have to, wrong way, this way, and they don't have to move their arm at all. And then you tie it, of course, try to, again, tie at the shoulder, not at the neck, and then you have a sling. And you'll adjust it from there. So if they can't move their arm and you don't want them to move your arm, that's all you're going to do. Just take it across the way, knot the elbow, and then take it across the back and tie it. So that's good. Yes? Yes. Good job. Good job, Campfire Girls, Boy Scouts.
That's right.
That's right. Next we have, let's go to, this is a splint. This is a metal splint. Blue dot, metal splint with a foam inlay. And so I believe it's for a left arm. You stay there, I'll move. And the way we're going to wrap is always going to be from the hand up the limb. No matter where we wrap from the end. So distal end to proximal end every single time. Because we want to move that fluid up. We don't want to move it down. And if we wrap the other way, that's what we're doing. So with a splint like this, you're going to start, this splint is way too big for her because she's teeny tiny, but we're going to use it. And you're going to, it's going to be a firm wrap, but it's not going to be a super tight wrap. And again, we're going to go down, I'm sorry, up, and then a little bit down, and then a little bit up, and then a little bit down. So we can have a zigzag pattern so it doesn't come loose very easily. Now, again, when it comes to these kinds of wraps, you have to watch your stretch. Number one, if they have an injury, is it painful? Number two, if you're wrapping digits or where you're touching skin, you have to come down. Let's see if we can see this. Go ahead and put your arm down this way. Can you see how that's a zigzag pattern? Yeah. And so then we need to make sure when we're done that we have good calf refill in the digits, and then we'll check that often. If they have an injury where there's a lot of swelling, then with them having their hand down, that's going to be an issue. So they will, if they're having a swelling injury, again, you're going to want to put that in the sling. But this kind of splint is made for maybe, let's say, a broken arm, but it's going to continue to swell. And if it's going to continue to swell, you need places for its expansion. And if it continues to swell, you also need to check calf refill over and over again within that first hour to 2 hours, and make sure that you teach them how to check that calf refill. So that's going to be important again for perfusion. All right. We're just going to take our time here. We'll wrap this up. A lot of times they still do make half casts for people that will form fit their arms. And so they're not made of plaster anymore, but they're made of plastic, a formable type of plastic. It's like plastic webbing. So it's like Curlex, but it's made of a polyurethane material that when it's wet or when it gets warm, it's pliable, but as soon as it hardens, then it's like hard glue, you know, or anything like that. So they can't actually go swimming with it because they'll get it wet again, and et cetera, but it'll start falling apart. But usually that's what you're going to see. You don't usually see those metal splints anymore. They like to form fit people, and metal splints are hard sometimes to medium, or the small doesn't fit. So this is a finger splint, you know, or a thumb splint, or a digit splint. And when people have a broken digit, this sometimes will be the splint for injury or a strain. Like, let's see if you can see. When I was a goalie, you can see how that one finger sticks out. When I was a goalie in soccer, this finger got bent all the way back here. And when it came forward, of course, it hurt so bad. So just for the next couple of days, I'm like, oh. But what should have happened is it should have been in a splint so that that ligament wouldn't have curled and I would have had a straight finger. So you could use a digit splint for that also. But let's talk a little about Coban. Let's say we're going to put a digit splint on. And when you have a digit splint, then you're also going to wrap that hand, let's see, sideways, yeah, sideways. But a lot of people think Coban is the coolest thing in the world. Coban is cool if you're using it for a blood draw because it's temporary. But if I'm going to wrap this splint, it's not so much a big deal on the splint, but then you have to connect it to the hand. So once you connect it to the hand, then you have to wrap the hand. Well, people like to stretch the Coban because it sticks to itself and it's cool and it's stretchy, et cetera, et cetera. But what happens is with Coban, it's easily stretched too tight. Then you lose perfusion in places all the time. This happens all the time when people try to use Coban for something that's more permanent than for just a few minutes. So for instance, Una boots. We did Una boots with Curlex and an ace wrap, which you can also wrap too tight, but Coban, people can't understand how tight the Coban really is unless you're wearing it, and it's easy, easy, easy to wrap with. It's wonderful, but you would never use it on something that's more permanent than an hour. Does that make sense? Good. Good class. All right. All right, let's talk about, this is like a carpal tunnel splint. So it's got a wrap, it's got its own Velcro here. But sometimes you have to be really careful with a carpal tunnel splint because this edge is plastic. And when this edge goes around somebody's hand, I think this is an older one again, but this one being made of vinyl here. And I think most of them now are, I don't know what the material called, but it's usually not vinyl and cotton and this. So let's just talk a little bit about if you put this on, no, I'm a liar. That's the other hand. If you see right here on her thumb, right here on her thumb, this would come up around her thumb here. And this part of her thumb is going to end up with an injury. So if they're wrapping this as carpal tunnel, you have to be really careful to look for injury to the arm underneath wherever it wraps around the thumb. That's a big deal. And then it goes around the arm. And again, it's easily splinted with Velcro straps. And that would go all the way down the arm. So it's easy, really easy for anyone to apply. But it's important that you talk to your client about not too tight, again, cap refill, and injury to any joint area where things are going around. Make sure that, I think the ones now are completely clear of the digit area. I believe it wraps across here and wraps across here, but it's usually completely free. But just so you know. Okay, that's usually used for carpal tunnel or an injury after the injury has begun to heal, like after a break. But they still want to protect it because it has metal on both sides, so it protects from bending, it protects from injury. All right, let's see. What do we have left? We have a C-collar, so a cervical collar, a C-spine, some people call it. And I always put this on upside down. It's kind of funny. It goes this way.
Yeah.
You want to put it on and talk about it?
Sure. So this is used usually if there's any sort of neck injury or anything you're wanting to immobilize the neck. Oftentimes when paramedics arrive at the scene of an accident, oftentimes if they aren't totally certain, they will immediately put on a C-collar just to protect the neck and the spine, just in case there's any sort of injuries. And it helps to just make certain that they are protecting that, most definitely. And otherwise, I've seen it in the hospital if patients have had cervical lammies, lumbar laminectomies, and they're getting up and starting to move around and all, they'll oftentimes put a C-collar on just to give them extra support while this is all healing back in the cervical area. So what you want to do is you want to make certain that your patient's hair is removed out of the way. And this front part is this divot right here is where the chin nestles. And then it comes on around. Thank you. Comes on around and well, this one has a Velcro strap that it just adheres to. It just fastens right here. Usually I'm used to like the loop ring, so you can pull it through and pull it back on itself. Also too, you'll notice in the front here, there's a hole if they are having to do an emergency tracheostomy or something like that. This is open here for that very purpose. But are you able to move your head? Usually just kind of an up and down, but it really does secure and support your.
I can penguin move.
There you go.
I'm a penguin.
Absolutely. It can definitely immobilize the neck and just make certain that the neck is protected. So
When I had my car accident right before Thanksgiving, and when the EMTs got there, I kept telling them, no, I don't have a neck injury. No, I don't have a neck injury. It was just the airbag. It was just the airbag that hurt me. And they said, okay. And then moved. And then he goes, this won't hurt at all. And he stuck one on me. And I'm like, I don't have a neck injury. Look, I can. He goes, stop moving your neck. And he put a seat collar on. And then immediately when I got to the hospital, not only would they not take the seat collar off, they started cutting all my clothes off because they didn't want me to move at all because I had the seat collar on. So I kept having to say, I don't have a neck injury, no spinal injuries, just airbag. I can't breathe. So it was a weird sounding breath that I was trying to take, and talking was impossible. But they wouldn't listen. They said, once you get done with your imaging, which was 4 hours later, and then doctor came in, she goes, oh no, you're fine. But before that, the nurse came in and she goes, did you hurt your neck? And I said, no, I didn't hurt my neck at all. And they go, oh, okay, well, let's take this off. Then the other nurse came in and he goes, no, put that back on, no imaging yet. And she goes, well, she said she didn't hurt it. Put it back on. So do understand your limits as a nurse. That you have to, if somebody puts a seat collar on, you need a physician or somebody higher than you to say, yeah, it's going to be okay to remove this. So
absolutely. And oftentimes too, after people have a traumatic injury, because the body goes into this protection mode when you go into a state of shock, you may not feel or be aware of your injuries, your pain. So many times patients that come into the ER and then they go home, they get home and all of a sudden they're like, oh man, this hurts now and this hurts now. And it's just our amazing innate intelligence being able to just protect our body and protect us from pain. And it's kind of interesting how that can be, how you don't have an awareness until quite a bit later. So
yep.
Anyhow, so oftentimes, even though patients are asked if there is still a concern, if it does appear that maybe the patient will have it, still continue to follow precautions. Most definitely.
I had a car accident. Well, I was rear-ended. We were at a light, and they were, for some reason, 2 car lengths behind me. Don't you love those people? They stop at a light. They're way back there for some reason. I'm not quite sure. But she decided it was time to go, so she hit the gas, and I was in the front. The light was still red, and she shoved me out in the middle of the intersection. And it didn't really hurt me because I got out of the car, I was talking to her, and I was fine. But by the time I got home, I couldn't get out of the car. I felt bad for her. I'm like, no, we're okay. I don't see any damage on the bumper. I think we're good. And my son was in the car too. And I didn't know. And I was stupid. No, I'm good. We're good. Yay. Feels all that epinephrine in you flying around and you can lift a car. Yeah, no, I couldn't get out of the car when I got home. And I didn't have a license plate, a name, a number, and nothing. So to get treatment, I had to sue my own insurance company for my stupidity. Oh, no. So interesting. It's interesting. So yes, don't ever assume you know what's going on.
Absolutely.
Okay.
Absolutely. I think this is our final piece of,
Yes, it is.
Of equipment to look at. So this is called an abdominal brace. And I know it's kind of hard to tell. It's very, very stretchy. These used to have metal stays in them, like the old corsets, but we've improved. So that part is good. These are called abdominal binders. So there's Velcro, there's strips of Velcro. I'm sorry, I know this is kind of hard to see. Blue dot.
There you go.
It has Velcro along the ends there. Anyhow, what you want to do, this is usually, because the waist is smaller, you will see that the binder kind of curves this way and
There we go.
curves. Yes.
It's not straight across, it's at an
not
angle.
straight across, it's at an angle because we need to fit our body, sculpt our body. So you want to think about waist here and pelvis down here where there's more room. So this aligns with the spine in the back.
Oh man, camera adds 40 pounds.
Oh, stop. I'm sorry. Then you wrap it around and Velcro it together, making certain that it is. Sorry, I'm just
No, you're fine.
making certain that it is snug. You of course want to pay attention that you aren't cutting your.
That's what.
Make certain that you aren't getting it too tight that it's affecting the patient's respirations. But
Yes.
definitely.
They should still be able to breathe.
Yes, absolutely. So, yes, I see this usually in the hospital setting for abdominal, if they have a big abdominal wound that maybe we're doing dressing changes on, or if the patient has had any sort of lumbar surgery, needing some support here in the back, that's usually when you will see the binders used the most. So,
Ta-da! And when they have abdominal surgery, if they're very obese, I gotta look right now. Holy cow, I look like I weigh 300
Oh, no.
pounds. I love it. I love it. Okay. So when they have abdominal surgery, a lot of times fat does not adhere to fat well. So you need muscle tissue with proteins and skin together, but fat does not adhere to fat. And so they may have tons of stitches when they split them up, the linea alba right up there in your human zipper, they split them up there and then the fat doesn't adhere. And so a lot of times they'll leave that dressing open, or if they stitch it, they have to have something to hold it together. So the abdominal binder is one. There's something called Montgomery straps, which is literally two, it's like, has shoelace holes here and you lace it back and forth so you can have it tight or not tight, but the middle is usually showing. Sometimes they'll tack in little horns where they'll just take rolled gauze and they'll create a closure, but they'll let it close. They'll let the, let's see, how can I do this? They'll let the wound close from the inside out instead of closing the wound and then finding this giant hole and abscess in the middle because the fat won't adhere to the fat. So abdominal binder, if it's stitched, they better have one or you're going to hear pop, 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 and then you're going to see guts spill onto the floor. That's what's going to happen. Happened to my Uncle Bob at Thanksgiving dinner. He had had heart surgery, but it had gone down into the abdominal wall. He coughed really hard and he didn't want to wear his binder because he was going to eat Thanksgiving dinner and cough and guts on the table. So, happy Thanksgiving.
yeah, really.
So, I think that's it. That's our Slings, braces, binders, and wraps.
There we have it.
That's a wrap, people.
That's right.
That's a wrap. All right. Bye.